Hello, everyone. Hi, Professor Kiesha Ray, PhD. Thank you so much for taking your time this morning to join us here during Amplifying Black Excellence Summit Series. I am personally very excited to hear from you and your expertise about this very important topic. About us understanding and addressing Black birthing mortality. So if you don't mind, Professor, I would like to just jump right into it so you can take up the space and teach us and educate us. I want to jump in the first question. What are the root causes of disproportionate mortality among Black birthing people?
Great. So first, thank you all. I appreciate this offer. It's really great to do these kinds of things. So I appreciate you, and I appreciate you too, Lucy. So first off, there's what we like to call that health is multifaceted, right? Health means many things. It can mean your spiritual health, your emotional health, your mental health, your physical health, but it also, and one of that we neglect a little bit, is your social health, right? So we like to always talk about social determinants of health. And that just means all of the things that can make us healthy or unhealthy, depending on our access to certain resources. So things like access to stable, proper housing. That's a really, really big one. In fact, I think that's probably the biggest one, is where you live, who you live with. What do you live near? Do you live near grocery stores? Do you live near noise pollution or air pollution or water pollution? Do you live near places for recreation? Do you live near a park? Do you have sidewalks where you can walk and feel safe? Do you have bus routes that go through your neighborhood? So social determinants of health are all of these social things around us that can determine our health. Like I said, housing, I mentioned transportation, I mentioned access to recreation, even things like access to libraries, to books, to literacy, things that help with literacy. So all these things determine health. And one of the problems that we see among Black birthing people and why there's inequities there is because there is inequities in the access to those social determinants of health. There's inequities in who has access to safe, proper housing, who has access to clean air and clean water, who has access to stable income and enough income, right? As we're seeing now with, things costing way too much, the price of eggs, right? All of these things, right? Who has access to proper income? All of that can determine how healthy it is for you to give birth, how healthy you can be during birth, and then how safe it can be to deliver and then survive, of course, after giving birth. And so among Black birthing people, you see these inequities, and those inequities also occur in the access to proper health care, the access to the kinds of prenatal care that you need, the access to the kinds of facilities that you need. And some of these inequities are a little bit more widespread among certain groups. So among Black people, among women, among transgender people, right? You see these increased inequities. And so people who can give birth are facing these inequities that are just impacting their health and their ability to safely give birth. And then there's another big social determinant of health that we see that affects this group, and that is the discrimination. Right. Discrimination is a social determinant of health in its own self, right? If you experience a lot of discrimination, you are going to have stress. You're going to experience, you'll experience less mental well-being. And those can have effects on your actual physical health, right? The more stress you experience, the worse your cardiovascular health is, the higher chance that you'll experience heart disease, that you'll experience hypertension, that you will experience some sort of mental illness. And so discrimination, the route that it takes to giving poor health is typically through stress. And of course, we know there are some groups that experience discrimination a lot more than others. So if you're experiencing discrimination, you're experiencing stress, and you're therefore experiencing the catalyst that you need for improper health. And we know that discrimination is itself a determinant of health, but it also influences our access to all the other determinants of health. So like, for instance, recently there was a study that said Lyft and Uber, they charge more money in Black and brown neighborhoods, right? We know that there are bus routes that don't go a certain time in certain Black and brown neighborhoods, right? They won't go
Right.
past a certain time, or they'll have
Mhm.
less routes in a
Right.
Black and brown neighborhood, right? So now there's less
Yep.
access to transportation that you need for maybe doctor's appointments, or that you need to go get care from your family and have that family and friend time, right? And so we see discrimination as itself a determinant, but also it flows through all of the others. We know that there's discrimination in income, right? We know that Black people, particularly Black women, we know Black transgender people are paid less than their counterparts in jobs. And then we know that even environmental pollution is not colorblind. Power plants, industrial facilities that emit toxins in the air, that emit toxins in the water, are all disproportionately built around Black and brown neighborhoods. We've seen this in Jackson, Mississippi very recently. We've seen it in Flint, Michigan. We see it in a lot of parts of Appalachia. We see it in Mississippi, Louisiana. Even right now where I live, we see it in Houston, Texas. And all of these pollution emitting facilities are predominantly located near families with low incomes and Black and brown families. And so when you're thinking about the people living in those communities, then giving birth or getting pregnant and wanting to have a successful pregnancy, it's sort of, the cards are sort of already stacked against them. They're already experiencing these inequities and all of the social things that they need to have a healthy delivery and to survive that delivery themselves. The last thing I'll mention, just because I don't think it gets enough attention, is this idea of weathering. I think it's one of those that we don't talk enough about, that weathering, this idea that when you don't have access to these social inequities, when you are experiencing multiple disadvantages, it weathers the body in the same way that you would have, like, if you left something outside for a really long time, the elements are going to weather it. The same thing happens to our bodies, to our spirits, to our minds, to our well-being, that we can be weathered. And this research shows that Black people experience weathering at a much higher rate than other people, and especially Black birthing people. When you are Black, when you're in that sweet spot where it should be really good for you to give birth, you've actually experienced more weathering than a younger white person. And so it makes giving birth even more dangerous, even though technically you're at the mid-20s, right? The age where your body should be saying, yes, you are a perfect age to give birth safely. But by that time, a Black person has experienced a lot of weathering. So it actually makes it dangerous. And it actually makes it more dangerous than if it were a white person who were younger, say 16, 17, 18. And so weathering really disproportionately affects Black birthing people. And then, of course, the effects of weathering can be passed on to the fetus and passed on to children as well. So it actually creates this sort of generational issue, this legacy of passing down disadvantages. So I know that was a lot, but it's a complicated issue. So that's just sort of the tip of the iceberg.
Wow, I personally had never heard the term weathering. And before I ask my next question, I wanted to, if you don't mind, explaining a little bit. You're saying research shows, so has the term weathering been in the medical space recently, or is it just something that's always been, it makes sense, but I've never heard of that before. So is it now like common now, like a word that like should be, is that new? Because it's just new to me.
Yeah, I would say fairly. I would say it's getting more traction in the last maybe 5 to 10 years. I would say it's a term that we're using more commonly, but it's not one that is an established word. As you said, you've never heard of it. That means that we're not doing a good enough job to make it just common in our language, right? So it is definitely, it's gaining attention, especially again, giving credit to the Black women and the Black researchers that have come before me. They have been the ones that have sort of coined these terms, just like obstetrical oppression, obstetrical violence, right? And it's giving new ways to talk about these issues in Black birthing mortality that we know exist, but haven't had the right sort of language to say these are the things that are happening to this demographic, and we have to do something about it. And so weathering is one of those terms where it's explaining a phenomenon, right? You think everyone, you think at the older you are that you should be safer to have children because you're more financially secure, you're more mature, you've had experience maybe around family or friends, you know what the birthing process is like. But actually for Black people, because of the discrimination that they face up until that point, it makes it harder for them, makes it less safe for them to have children than if they were white and young. And so that's kind of like, we've always known that, but I think weathering has been used to give it a name, right? Like how do we name it? And then we can say, now that it has a name, how do we address it? How do we talk about it?
And so to add on to that, then what are the barriers to care for Black patients, and how do these impact then Black birthing mortality?
Right. So social determinants of health are mostly things that are experienced outside the clinic, right? So when we talk about Black birthing mortality, we have to sort of talk about it in two ways. What happens to people before they get to see a doctor, before they get to the clinic, and then so the inequities outside the clinical setting. But then we also have to talk about inequities that happen within the clinic, right? So even if you have the perfect life outside the clinic, you still are subject to medical care and all of the issues of healthcare in your country. And so you have to sort of talk about this as a twofold problem. And so when we talk about these barriers to care, when we think about care, we have to think about the caregivers, right? And so we have to think about the inequities that happen within, essentially talking about medical racism, right? So it's this racism that happens from healthcare providers, racism that, and it can happen even between doctors within themselves, nurses within themselves, therapists within themselves. We're talking about it from the patient perspective. And we're talking about it for Black birthing people. We have to think about it as this sort of historical problem that just kind of never went away, but took a different form, right? So there's always the healthcare. The very foundation of healthcare was built on experimentation on Black people. It was built on not giving us regard and care, and not giving us compassion, not seeing us as fully human, and not seeing us as worthy of care and compassion. And so we have to remember that things can just sort of be repackaged, right? We may not flat out be saying these very racist things, but they just get repackaged and they become more subtle, but they're still there, right? And so one of the things I think we always have to think about is how these narratives about Black people just sort of got repackaged. And so these tropes, especially about Black women in general, about being overly sexualized, or being sort of Jezebels, or being using their feminine wiles, right? And so when they would see pregnancy, they would see that as sort of immorality. Like, look at what you did. You were this sexual person, and now you've gotten pregnant. So why do you deserve my care and compassion? And so when we're talking about Black birthing mortality, we have to think about just how medicine thinks about Black people in the past, and how it is still sort of happening in these very different ways. And so when I think about barriers to care, I really think about how medicine thinks about us, but then also how, like, as an educator, I teach medical students, so how we educate medical doctors, future doctors. It's something I take this role very, very seriously. I teach future doctors, I teach future dentists, I teach future nurses. And so to think about how I can bring my work to them, because we have to sort of change how they're educated, because eventually they're going to be someone's doctor. They're going to be someone's dentist. They're going to be someone's nurse. They're going to be someone's therapist. And so they have to know this history, but they have to know what they're stepping into. They have to know that when you put that white coat on, you can either be a barrier to Black people's care, or you can be a facilitator of their care. And I would prefer them to be on the facilitator side. And so I try to show them their sort of role in all of this. And so for me, the barriers are how healthcare thinks about Black people, how clinicians as individuals think about Black people, and then to think about their lack of care, their lack of compassion, how that can come out as lack of concern, lack of listening, lack of believing their problems. And I mean, we just have too many stories that the stories are real. We have too many stories about Black birthing mortality for it to just be this one-off problem. So I think I am ultimately a philosopher. So I think the stories are important, and we have to pay attention to the stories. The stories are research. You don't have to have just statistics and data. The stories are research, and they're worthy of being shared. And that is worthy to talk about, just seeing how Black birthing mortality actually works in a person's life and in a family's life. So I think taking the stories seriously and not taking them seriously is the barrier as well.
Professor, you have started something. We've got some questions. We're going to go
right.
over it a little bit.
Let's do it.
I'm going to start with Simone Ferguson. Shout out to Simone Ferguson. She works at the Science and Air Museum in DC, Smithsonian. I'll be meeting with her later on today. So I wanted to ask her question first because she's going off of what I was talking about. She says, wow, weathering. Is weathering only used in mortality space, or is it, forgive me, sometimes my reading, perpetually prescribed to medically oppressed inefficiency treatments? That was a great question. Exactly, because I was actually going because I'm a woman that's not gonna be having a child or anytime soon, or but I feel that weathering just my relationship with hospitals, based on like, not the time and space, based on my family's experience of like illnesses and stuff, just my apprehension of going to the doctor. So yeah, that's why I wanted to continue with that question. And then we've got two more that I think we can get to as well. So yeah, do you want to expand on that?
Yeah, absolutely. So I will say, I just got done writing my book on all of this stuff, that exactly what we're talking about. And when I was recently doing this weathering research, there's a lot of it to come out of women of color, out of Harvard, a lot of Black women, again, who've been doing this Black birthing mortality work. And I've only seen weathering to talk about it in that space. Now, again, I'm a philosopher, so we take things and abstract them and apply them to lots of different things. So if it's speaking to you in another aspect of your life, I will say absolutely, give credit where credit's due, but then absolutely abstract it and apply it to whatever situation you have, because it's a very general idea. It's very basic. It just says, hey, when you experience a lot of disadvantages, it wears on your body, it wears on your mind, it wears on your soul, it wears on your health. That can apply to a lot of different things. I can think of things like child abuse, right? That can be an issue of weathering. I can think of domestic violence, right? I can think of, I'm an academic, right? Academia can wear you down. I can think of academia, right? I can think of maybe corporate America. I can think of a lot of different situations where someone is like, I feel like I've just weathered by this situation. And so I absolutely believe that it can be abstracted to lots of different things, because it literally just says, hey, disadvantages are bad and they accumulate. And I think that's a key word there, is that they accumulate and they compound. So when you experience them over and over for years and years, that weighs on you. It's heavy. And I always like to think, I read somewhere, like, think of a piece of paper. If you leave it outside for a year, it's a fresh, clean, white sheet of paper. You leave it outside for a year, it's going to get rained on. It's going to get stepped on. Maybe a dog comes along and chews it up, and you go there for a year. That white paper looks nothing like the initial paper that you put out there. That can be our body. Those elements can be all the disadvantages that we experience, and we are that paper. And it also, I know it sounds bad, for me, it's kind of uplifting, because then it thinks like, I need to take care of myself. Like, I'm that paper, I need to take care of. Nobody else will. Right. I absolutely need to make sure that I'm taking care of it. And also feeding into other people, helping them take care of themselves, and feeding love into their lives and helping them take care of it. So, I can see where it can be sad, but for me, it's a reminder to take care of ourselves and to help other people take care of themselves, and be kind to other people.
I absolutely agree. So there's another question about policy, like what policies can be put in place to ensure equitable treatment for all pregnant women, regardless of race. And while you're formulating that, two other comments from Tamika says, a friend of mine told me her white male doctor chastised her when she was delivering her baby. She was 17 years old. Imagine being in a vulnerable state, and someone who is supposed to be helping you talks down to you. Her story made me sad. Carla Israel says, I really appreciate you using gender neutral language while referencing the birthing people. I agree. Shout out to you on that. I agree, Carla. My trans kiddo overheard, and we both cheered out. Yes, let's go.
I'm happy about that. Yeah, so I'll try to separate these. I make it a habit to use birthing people, because I think not only is it inclusive, and when I talk, I want people to feel included, but I think it's appropriate because there are lots of people who can have children, right? Now, there are some things that may be exclusive to Black women, and when they are, then I use that language. But there are some things that are not exclusive to Black women. It's just Black people, and women are people too. So,
Yes.
and so for me, I try to, when I'm using certain research, I try to use the terms appropriately, but also I want all to feel welcome. And again, it's just true to reality that there are just some issues that are applicable regardless of who you are. It's just a matter of, can you give birth? And if you can give birth, then you are subject to this as a Black person. Policies is a big deal, because for me, that's where I think the change has to happen. Because I'm very big on putting the responsibility on the perpetrators. It's all great for us as individuals to say, these are the things that I can do to protect myself if I become pregnant and I want to get care and I want to make sure that I have a safe delivery. And we should, but I also think it's sad that we have to do that. We should, yes, but I want to put the responsibility on the people who created the problem. For me, that is our systems, as our institutions, as our healthcare, that is the clinicians, right? And I tell my students this: you are the clinician, you have to take this on. It's not your patient's problem. They want to make sure that they survive, yes, but ultimately you, as this representative of this institution that has been historically racist and sexist, and classist and ableist, right? You have to take on that work. And so for me, policies, there are a lot of things that have already been done that have been somewhat successful. So for one, North Carolina is essentially got rid of their gap between Black birthing mortality and white birthing mortality by instituting social programs. What they did was they incentivized physicians to identify at-risk people and said, hey, now we know that you have diabetes. Let me make sure that you know what diabetes even means. Let me make sure that you know the medication that your doctor gave you, what that's even for, what that does. Let's make sure that you know you have to eat when you take it. Do you have a way to get to your follow-up appointments? And it was all very simple. They just basically gave them a social worker. And then after they were born, it didn't stop. After the babies were born, it didn't stop. Then they said, okay, do you know where your local daycare centers are? Do you know how to make sure that your kid gets in there so that you can go to work? Do you know how to read a bus route map and get to work, right? Do you have transportation? Do you have a social support? And so it was making sure they had these resources. And once they did that, it's almost essentially gone in this part of the country, because they made sure they had access to those social determinants of health. They made sure they had access to the resources. And then there's institutional policies, like in California, making sure that their doctors who are interacting with Black patients and with Black babies, particularly, that they have that education, that they know about medical racism, that they know this history. So also making sure that your clinicians know the issues, because sometimes they'll claim that they don't, and sometimes they don't. Not all medical schools educate them on these kinds of things, right? And so making sure that they know that, but making that a policy, education, and then also checks and balances, I think, can also help in hospital settings. Having a system of power where you're having people follow through with patients and not just assigning them one doctor and then moving on, but having someone be that backup to that doctor can also be very helpful. So those are just a few of the minor things. I'm also very big on supporting the people who are already doing the work. Black Mamas Matters Alliance, Root, ROOT. They are organizations led by Black people who are already doing this work to have education out there, to hold summits, to make sure there's financial resources, support them, whether that's time. If you have the expertise and want to go help them, do that. If you just want to give them some money, give them some money, but help. There's a lot of Black people, particularly Black women, who are already trying to do this work. Support them. They're going to go talk somewhere, go be in the audience, go zoom in and listen to them, right? So I want to make clear that I'm just a part of this people who are doing it, but if there are people doing it, go support them. They know what they're doing. They have the cultural competency, so just support them.
We have a couple of minutes, so forgive the compound question. Mm-hmm. For the Black people in the audience who are considering becoming pregnant, what is your advice about communicating their needs to their OBGYN and including needs related to pain management? And on top of that, for our allies in the audience, how can we help advocate for Black patients?
Right. So I'll try to keep it short. First thing I would say is don't be afraid to just flat out say your worries. Just say, I'm a part of this demographic. I know the statistics. I know the stories. I don't want to be one of those statistics. Can you tell me how you're going to make sure I don't become that statistic, right? What do you know about Black birthing mortality? Just ask, ask your clinician flat out. I want to make sure this does not happen to me. How do we make sure? I am very big on making sure that everything is documented. If they deny you pain management, say, I would like for you to chart that and ask them why. Why are you denying me this? And then if you have a problem, ask them, and they're not taking you seriously, they're not giving you the proper diagnostic treatment you need, ask them what could happen if you don't get it. So if I have a cough, what could the worst case scenario be? The worst case scenario, you have lung cancer. Okay, what's the best case? Best case is it's a cold. All right, I want all of that documented, right in my chart. Now I want you to tell me how you know it's not lung cancer. How do you know it's not these other things? And then sometimes I've seen it happen. That encourages them to say, you know what? Okay, let's go at least get a CT. Let's go ahead and at least do some blood work, because they also don't want to be at fault. It is a very litigious place, and they don't want that. And they also can sometimes show that you know about your care, you know about your body, and you want them to take you seriously. So it's a little bit of self-advocacy. And then also, if you're an ally and a friend says, hey, will you come to the doctor with me, be my eyes and my ears and help me, go with them, make the time, go to a doctor's appointment with them. Again, that puts the onus on the individual, which I don't really like, but sometimes we do have to take care of ourselves and stand up for ourselves while other people are doing the work in the background to change actual systems.
Professor Kiesha Ray, PhD, thank you so much for this topic. Thank you so much for informing us and letting us know more about this topic in general. I'm very, very appreciative, and thank you so much for your time. And
thank you.
I'm excited. I'm going to get your book as well. And
appreciate it.
will, thank you so much for this. And thank you for being part of our Amplifying Black Excellence Summit series. This was a pleasure.
Thank you. I appreciate you.